Welcome back, everybody. This Week in America, website thisweekinamerica.us. Back with us, as mentioned on the program, was with us last week. So much information in his book, When Tumor is the Rumor and Cancer is the Answer. He's back with us again, he being Dr. Kevin Ryan, board certified in internal medicine, hematology, oncology, retired, a decorated full colonel from the U.S. Air Force, and a cancer survivor and author, as I said, of When Tumor is the Rumor and Cancer is the Answer. Website is very simple, When Tumor is the Rumor and Cancer is the Answer.com. You can link on to our website, thisweekinamerica.us, and go directly to that website. An award-winning book, by the way, been called a must-read for any cancer patient and their family. Dr. Ryan, great to have you back with us. Thank you so much for making the time to be with us. We just touched the surface last week, and since this is a disease that will touch so many of us, it's very important to have you back with us. Thank you for being back with us on the program.
Oh, it's my pleasure. I wish we had more time.
We actually need that. We could spend hours in talking about this. In the book, When Tumor is the Rumor and Cancer is the Answer, we talked about anxiety, dealing with that. The doctor knows firsthand, looking into the eyes of newly diagnosed cancer patients and seeing that anxiety. He was a cancer patient himself and went through it just like all of us do. We talked about autonomy. We talked about mindset. That's in last week's program. You can listen to that by going to our website, clicking onto iTunes or to YouTube to get to that, or you could read the book, When Tumor is the Rumor and Cancer is the Answer. I want to talk about teamwork because that's something you alluded to the last time that is so important. It's not just the doctor. And when you think about it, oftentimes the doctor is in and out real quickly. Other members of that team are with us, and maybe at a moment when we're not as guarded as when the doctor is in the room. We're more free to talk to the others in the team. Talk about the importance of teamwork.
You did it again. You nailed it. Somebody who was in the boat, the metaphor being the boat of life, fell out, got pulled out, wind blew them out, wave pushed them out. Something went wrong, and now they're out there in tumultuous seas. If you have everybody rowing in a different direction who's in that boat, you probably hit them in the head and they'll drown, but you certainly won't get them in the boat. But if you have someone who takes charge, coordinates the efforts, everyone knows their job, everyone pulls together, everyone communicates clearly to each other, everyone makes sure that communication was received and understood as intended, and you end up lovingly putting this person back into the boat and being able to go to shore where they can continue the fight of their cancer. And I think that's a good metaphor for it. Being in the military and also being a colonel a full professor rather at UC Davis, you see this with the medical students and then the interns, the residents, and the fellows. And that was one of the second or third things that I said, first being shake their hand and say thank you and watch their reaction. The second being talking about anxiety and autonomy. And then the third being you are not alone. I'm sure there are loved ones in your family. I'm sure there are ones you want to know about what's going on. I'm sure you have close people to you that you would want to know what is going on. This is not a dirty word. You didn't do anything wrong, and it doesn't really matter right now. We can discuss that later if you had a role in causing your cancer. But the idea is this. We work as a coordinated team, from the person who welcomes you at the desk to the nurse who sees you every time you get your chemotherapy and you talk to about your grandchildren or your children or your dreams or your hopes or your visions or what's coming up. Those are angels. Oncology nurse specialists are the angels in the clinic. And then you have the little cherubim and seraphim, if you will, which are the front office staff that remember you every time you come in, ask how you're feeling, greet you with a great smile. These things really lift you up, especially when you introduce the patient to all of them on the first visit and say, don't worry, you'll get to know their name and they will get to know you. Golden State Warriors had not won much of anything for a real long time. They don't have, individually speaking, all of the best players in the league. They don't. They have one who was the MVP, he deserved it. What they have is a team, because basketball is a team sport. Even LeBron James and the Cleveland Cavaliers could not beat them, the Golden State Warriors. So you create synergy. Military officers have known about this during war, of putting different resources together, solving problems in life, solving problems in a marriage. You bring people together and you listen if they have ideas. Remember, the patients may tell things to the nurse or the front office tech people or the other tech people. They don't tell to you. It's not usually that they forgot, it's because they're afraid.
Yes.
That's why you have weekly meetings on every patient with every staff member, and you go over them all, and they're stool pigeons. They laugh. They tell you, hey, I think you need to know that there's a brother-in-law that's going through something bad, but he didn't want to burn anybody else down, or whatever it happens to be. So that's got to be the orientation. Last reason, if you want to maintain the staff for more than 2 or 3 years, because it takes that long to build that kind of teamwork, you'd better have teamwork as number one priority, because this is emotionally very, very heavy work. You're taking on people who could very well die, and they don't go away. They don't get the cardiac surgery, recover, and walk out the door. They come back and come back and come back. And although the stats are better, all the way up to about 49-50% survival rate, that's still not that hot. And we still get people getting sick, and who have to return and get sick again for their next treatment. Do it as a team, and the team is going to win. Don't do it as a team, don't do it at all.
Like so much in the book, maximizing your chances to beat the odds and to survive. Dr. Kevin Ryan, our guest on the program, board certified in internal medicine, hematology, oncology. The book is called When Tumor is the Rumor and Cancer is the Answer. The website is very simple. When Tumor is the Rumor and Cancer is the Answer.com. You can link on directly to Dr. Ryan's website. A lot of great information there as well by going to our website, thisweekinamerica.us. Let's sort of break that title down. When Tumor is the Rumor. Let's talk about that stage where we really suspect something is wrong, and we pretty much figure out afraid at least what the diagnosis is going to be. Talk about what we should do during that period. What's the mindset that we should have during that period when tumor is still the rumor?
Okay. First would be, give yourself permission to be anxious. It's fear of the unknown. You don't know yet, but that leg has not hurt like that long ever before, or these intestinal problems have never been like this ever before, or there's a mass in your breast and you know it's there and it's never been there before. And I can go on with many other different examples. There's fatigue, weakness, sweats, many symptoms that vary by tumor, and they've never been there before. So give yourself permission to be anxious. Turn that anxiety into fear with your referring doctor by getting in right away to the oncology people. Do not allow delays. This is where you take a good charge and say, I want to be seen right away. I want to know what I'm dealing with right away. And you want to know who they're going to refer you to. Are there other doctors in the oncology department in the hospital that you're referring to? Is there a major university nearby? These are the types of things that you want to think about while you're suspecting the diagnosis. And you want to be reading the book. Because if you're reading the book, you'll know all the things that there is to do when it's not yet a diagnosis of malignancy. Don't call it that yet. It's a suspicion of one. You have to have a biopsy. It has to be looked at. It has to be studied for many intricate aspects. And then a determination is made as if there is a malignancy or if this is not a malignancy. And that can happen just as easily.
The book is called When Tumor is the Rumor and Cancer is the Answer. It's really a must-read. It is designed for cancer patients and their families. It's an award-winning book. It's written by Dr. Ryan from his experiences on the front line of cancer treatment and being a cancer survivor as well. The book is laid out very well. As I say, it's very easy to read. Once the diagnosis comes back and cancer is the answer, where do we go from there? Because we're hit, even though we might have suspected it, we now hear the words coming out of the mouth of the doctor that, yes, there is cancer. We keep reading of all different treatments. We go through possibly the mention of clinical trials, of complementary alternative medicine. We go to the internet at 2 o'clock in the morning because we can't sleep. Where do we go from there when cancer is the answer? How do we determine how to proceed at that point?
You go to your physician first, no matter what you initially feel. You go to your physician first, and you engender, in your best way, a sense of camaraderie and hope. You tell them that you're afraid. You tell them that you will benefit immensely from information. And because you've read the book, you'll ask about, are we going to stage the cancer as to what level of advancement is it? When will we do it? Who will do it? Where will we do it? How will we do it? Are we going to do special stains on the cancer cells, which we now realize in many, many cases can be extremely useful? Do you have clinical trials here that address my kind of cancer? If you don't, does the nearby university have trials that I could be enrolled on? Could I be treated here but enrolled on the trial there if I'm eligible for it? These are the kinds of things that you ask. They put you in control by asking all of this. You can ask, am I going to die? But the doctor's going to tell you, I'm not a genie. But they can be honest if you push them and say, if you take 1,000 people, the survival rate of this is only a handful. But you are an individual. What you want to hear from that oncologist is, you are not your cancer. Your cancer is a disease. It is not who you are. Don't make that mistake. Be an individual, be yourself, and go out into life with that attitude. You are not your cancer. You are not your disease. And we will fight this as a team, and that you want to hear that. And the team has many members, and you want to hear that. You ask these questions because it's there in the book. That's what you want to know. Those are the things you want to hear. How soon do we start? Are we involving radiation? Are we involving any surgery? Can you treat me if I have any nausea and vomiting from these drugs that I've read about? How effective is that treatment? Are there backup treatments if there's this nausea and vomiting doesn't, is under control? Is there a backup treatment for the main treatment that you're going to try for me? Is there something else that can be tried if it doesn't work? These are all the questions that you would want to ask and get down in the first couple of sessions after the diagnosis is made.
That's why the book is so important, because it walks you through the process. Everybody's concerned about side effects. You do an excellent job of going through and addressing that. You answer all questions, even those that there really isn't an answer for. You tell us there's not really an answer for that at this point in time. The book is When Tumor is the Rumor and Cancer is the Answer. Our guest on the program, Dr. Kevin Ryan. Part 1 aired a week ago. You can listen to that, watch that by going to thisweekinamerica.us and clicking on either iTunes or YouTube, so you can get the information from show 1. And certainly the book, When Tumor is the Rumor and Cancer is the Answer. It's available all across the country, available at Dr. Ryan's website, which is When Tumor is the Rumor and Cancer is the Answer.com. It's very simple. If you can't remember all of that, just go to thisweekinamerica.us and click on the link. Go directly to Dr. Ryan's website and get that information. A few minutes left in the program. It goes by so quickly. And let's talk about the future. I know you're optimistic. You're hopeful. We keep seeing all of these signs after all of the billions of dollars that's been spent and the hours of research. I don't want to put words in your mouth, but how do you feel about the future? Are we making progress?
Yes, we are making progress. I'm extremely excited about the future and it decides on the size of your ruler. I use a ruler that's appropriate for what's involved in coming up with a new drug, which is about 5 to 7 years. To get it all the way through the clinical trials, phase 1, 2, and 3, which I explain, and then have the FDA go over it very carefully, all the results, as well as many other people before that, and make a decision if in fact it's safe and effective. They have given one drug approval for pancreatic cancer that it didn't do anything to the cancer cells, yet it made patients feel better. They approved that drug. So these are not people without a heart or without a mind. These are very bright folks. As far as the future is concerned, you step back and say, cancer means there's been an aberration from the norm. Well, to be aberrant from the norm means you must have something genetically different that's driving your advantages to hide from the immune system, to conquer the immune system, to build new blood vessels to feed yourself, to be able to spread and home in on certain areas, to be resistant to chemotherapy, to capture a drug when it comes into you and encapsulate it and then break it down so that it doesn't hurt you. You as a cancer cell must have mechanisms at the genetic level and at the immunologic level that are giving you an advantage of survival over the body's own immune system, which is driven by its genetic blueprint. And we are now way past the drugs that, like mustard gas of the 1940s, were 21 points greater in survival than 30 years ago. That's huge. Not relative increase, absolute increase. Used to be the majority of adults died. And as I said earlier, that's not the case now at all. So there's a lot that's being done. They're using viruses, screwing around with them, essentially, so they can't hurt you, but taking advantage of their ability to invade where we've never been able to invade before in the cancer cell. And when they do that, they either start to make more of themselves, or we put a missile or a payload, a toxin, along with them, and that kills the cell. That research is starting out in pancreatic cancer. Nanoparticles we're finding have a role. This is amazing stuff. Trying to switch various segments of DNA, a false message inserted to self-destruct. That's starting to being looked at. Precision medicine has already launched where, for your cells, where are the Achilles heels? They study in the laboratory, they try and give it back. In stem cell transplants, bone marrow transplants, they're finding a way to gin up and power up the already powerful T cell lymphocyte, real killer cell. I mean, real good killer cell. But even they can get fooled. They're finding ways with embryonic stem cells to hide them, get them in the infusion, and then they multiply and eat the leukemia left and right. All kinds of ingenious things are going on.
I can see why you're excited.
Well, yeah.
A lot of exciting, in fact, more than I realized. And a minute or so left in the program. Dr. Kevin Ryan has been with us, and in another program, we're going to have several people who actually used his book, and we're talking about how useful that's been, how helpful. The book is When Tumor is the Rumor and Cancer is the Answer. What's it like, and I've got about 2 minutes left here in the program, what's it like when you get feedback like we're going to hear over the next couple of weeks, when you hear someone say, I actually bought a copy, took it, and gave it to my doctor, and that communication line is now there. There's this better patient doctor communication than we had before. What's it like when you realize the book, When Tumor is the Rumor and Cancer is the Answer, really is, in a very positive way, impacting lives?
I often weep. I think that would be the most common thing, that God has given us gifts to use through grace to help others. It's very hard to do, but when you have that chance and you do it, and you don't do it for applause, you don't do it for hooray, You do it because when you give, you get back more. That would be my answer. Part of why it took so long. It was so hard to write at the end when I wrote the stories of the patients, some of whom were alive, some of whom died. Just remembering it, and myself thinking, I could never do this. I could never do this. And that's what I thought when I was first diagnosed. So yeah, my answer remains the same. I get misty-eyed. I go to a sacred place, like when you help someone, and they had no help. That's what I feel.
Well,
And we are all capable of it.
You turn that hopelessness into hope. In reading the book, you find you're not alone. You're not defined by your cancer. There are answers, and they are in the book. The book is called When Tumor is the Rumor and Cancer is the Answer. Our guest is Dr. Kevin Ryan. His website is very simple, When Tumor is the Rumor and Cancer is the Answer.com. You go to our website and link on directly to Dr. Ryan's website. Dr. Ryan, thank you so much once again for being with us. This program, as well as the part one we did with Dr. Ryan, available by going to iTunes or YouTube. And you can do that by going to our website and clicking on the appropriate icon. Thank you, Doctor, so much for being with us on the program. It's been very informative and very helpful. Thank you.
Thank you. This is the best interview I've done.
Well, thank you for that. And you wrote the book, and the book is helping so many people. When Tumor is the Rumor and Cancer is the Answer. You can get all the information at our website, thisweekinamerica.us.
Thank you, Rick.
Thank you.